reinforce our understanding of the top layer of that diagram there. I punished myself by cheating and taking somebody else's slide. I stole Mark's slide because I thought I don't want to create my own slide, but I've been punishing myself because, Mark, you have to do it one by one, don't you? And I didn't realize that when I stole that slide. Okay. So essentially, we're looking at these areas today: laws and policies, data and evidence, leadership and management, and finance. And we have two of the sessions that will follow me. One of them is slightly different, actually. It's looking at systems assessment, which doesn't quite fit in that framework. But one of them is on data and evidence, and one of them is on finance. So I won't talk too much about those areas. I won't talk much anyway because I've only got 10 minutes. But first of all, you say the way our conceptual framework, in a sense, puts all these things at the top. This enabling environment is put at the top, and it's very much a kind of rational planning model with the assumption that things happen at that level and then they come down through the different areas into service delivery. I mean, as we know, things are actually much messier than that. And if you don't get things right at the service delivery stage, if you don't, for example, involve the teacher education people in the policy on inclusive education, the policy is never going to work because they're the key providers. But you have to simplify things in order to put them into some kind of diagram. So that's essentially the enabling environment are these four areas at the top according to our conceptual framework, which is also open for discussion. Now what's happening now, Mark? Okay. Oh, my own did the same thing. Okay, that's because I copied the squares. Okay, so, I mean, we all know, I think, the top line there, you know, the key conventions and things which have helped to frame things, which people have used to try to encourage governments to move towards a more inclusive approach, with the Convention of the Rights of the Child, Salamanca, CRPD, the SDGs. It was very important that disability really forced its way into the SDG agenda, which was great. And then the General Comment 4. Now, when it comes to legislation at the country level, this is reflected in different ways. In some cases, countries have constitutions which reflect things like the rights of people with disabilities. It's actually in the constitution. Some countries like my own, actually, UK, don't actually have a constitution, but there are various ways in which they commit to things. And then there's the law aspect. Quite often things happen at the policy level, and sometimes the policies don't actually get enacted into any kind of law. So the policy is some kind of vague statement of intent about what a government wants to do, but it doesn't actually get reflected in laws. And quite often the implementation regulations is where it might also get let down because there's no real follow-up in terms of how you regulate the implementation of the law. In many countries, what happens instead, in my experience, having worked in several countries, you get kind of guidance documents issued by the Ministry of Education saying, you know, go and try and do this and try and do that, but they're not actually supported very firmly by laws or whatever. So that's the laws and the policies, I think, which we all agree are extremely important, but we know that in themselves, they're not often going to lead to any real change. And then the data one, which I'm really going to skip over because Daniel and Suguru are going to be talking about this. But I think this slide is quite telling because it shows how many different data points you need to refer to in order to get a good grasp on children with disabilities. So, for example, if they're out of school, you have to look at household surveys. You can't look at MS data. If they're in school, you can look at MS data, but maybe they're not evident in the MS because the MS hasn't been adapted to include children with disabilities and so on. And what's often the problem is people are collecting data like DPOs and NGOs and development partners, and quite often that data isn't really shared. It's not really joined up. So that's the enabling environment in terms of data and evidence, but Dan and Suguru will talk more about that. Now, is it going to change? Okay, leadership and management. I tried to, you've all got very nice document with these. You've seen the document with the different aspects, haven't you? So I'm just picking out some key concepts from there. And I think one thing that's been said already is that, and that's why in a way I've got reservations about the enabling environment being put above the other areas, because in many countries now there's a decentralization process. And I think you were saying in South Africa, things are very decentralized. So the capacity of the center to actually control what's happening in different provinces is quite limited. So that's one aspect. The other aspect is quite often you get the leadership at the central level, and people have been on trainings, they've been on conferences, and they understand the concepts well. But when you get down to the district level and so on, there's a much weaker understanding. And you get down to school level, and often there's an even weaker understanding. Or sometimes it might be the other way around, you know, where DPOs have been very active working with a collection of schools, and the schools know what they're doing, but the people at the center don't really understand things. So it's an interesting process. And I always see this as a two-way flow, ideas coming from the center. It should be anyway. And then, you know, interesting ideas being fed up from the ground to the center. And then obviously monitoring and evaluation is a critical aspect of inclusive education. We don't talk about it that much over the next 3 days, but one obvious cadre to work with if you're going to do inclusive education is the inspectorate. I was saying to my friend from Kenya, I used to work in the Kenyan inspectorate, so I always think inspectorate. You have to involve the inspectorate, and because that's mainstream monitoring and evaluation, so if they're going to the schools all the time, they should be looking at inclusive education. And then the partnership concept is extremely important. DPOs working with governments, development partners, NGOs, faith-based organizations are very, very important player in terms of education, inclusive education. So they need to be involved. So when you do your analysis, when we come to the group work, you can be looking at these different dimensions. You don't just have to look at the areas we're presenting on, which is essentially data and finance, yeah? And then this is the really tricky bit, isn't it? How you get all these different ministries to work together. Who leads the process? Which ministry is in charge of disability issues? I thought you'd give me the answer. And it's an interesting question, because this is not the only area where we've had to struggle with this. When I was working for UNICEF, one of the areas we're really pushing was early childhood development. So same question, where do you house it? And then how do you get the different people to sit together? It was the same thing with HIV/AIDS, cross-sectoral. So how do you actually coordinate it? So we should better draw from the experiences of those other areas in terms of that collaboration. But it's a difficult one. Jennifer told me not to show this slide because she said I might confuse you. But said don't bring in another conceptual framework. But I just wanted to show one conceptual framework, which is many of us have been working with, especially if you're my age, where I was working for DFID and then I was working for UNICEF later, was the framework actually developed by the World Bank on school effectiveness. And this is an important framework when you come to look at what is actually happening at the level of the school. This is really what's happening at the national level. So I thought it was worth sharing. It's very, very much tried and tested, and it's got all the same components as our framework. But interestingly, you've also got your enabling environment here as part of what happens at the school. In other words, you have to have effective leadership, capable teachers, etc. So it's just something to bear in mind, and maybe something that we'll think about more in future when we're relating this model to what actually happens at the level of the school. Financing, we're going to have a session on this, but one of the critical issues is what are the sources of the financing? How much, to what extent are they domestic? To what extent are they coming externally? If they're coming externally, sometimes it's harder to control. The agenda, etc. And then the different funding mechanisms. I think one interesting thing to look at in terms of disability is if you look at the history of what happened with girls' education and gender, when quite often governments would nominate their gender focal point and they'd give them a little line in the budget, and at the end of the year that line often wasn't spent. They didn't know what to spend it on. But it didn't necessarily mean that nothing's been spent on gender, because you're much better actually to mainstream it. So when you're training teachers, they're sensitized to gender issues. When you're developing textbooks, they're also gender sensitive. So to what extent you can actually take the data from all those different areas of expenditure and put it together and say this much is being spent on inclusive education, I think it's really difficult, because if you're talking about inclusive education, you're talking about transforming the whole education system, aren't you? So it's a tricky one, but BFIT has got the answers to this. So that's not a problem. And then the final one we look at is the key steps in education financing, and BFIT will take us through that. Okay, thank you very much.
Is that a clicker? Yeah, thanks. I guess I should get out of the way. Good afternoon, everyone. Can I just have a show of hands of how many people participated in the data webinar? Okay, great. Then I can be really quick, because I think the question and answers, especially on this topic, are more valuable than. But I am going to go through some things quickly just to refresh your memory and get us all on the same page. This might seem like a really silly thing to start off with, but I've been involved in collecting data in a number of countries to know that it's quite often neglected. And that is, what's the purpose of the data collection? People say, oh, we need data, let's go out and collect data. But they don't sit down and really think through exactly why they're collecting data and how they're going to use the data. You should know how you're going to use the data before you design the data collection system, so to make sure that it's designed in a way that actually meets the purpose. I've been in places where people wanted to collect data, they got the data, they went to use it, and it was not usable because the data did not match the purpose. And also, we want to have a coordinated data system. Right? We use administrative and survey data together, because there are multiple purposes for data collection. Therefore, there can be multiple sources of data. And if we don't align them correctly, if we do align them correctly, they become much more powerful if they can be used together, and they create a lot less confusion when one ministry says one thing and another survey says something else, and everyone throws up their hands and says, we don't know what we're talking about. And then we've been talking about education, and again, this is particularly important when we want to look at in-school versus out-of-school kids, because obviously administrative data doesn't capture kids who are out of school. So what are the purposes of data collection? Just to, again, we went over this in the webinar, but there's monitoring, which is typically done with administrative data, monitoring service delivery, monitoring the implementation of policies and programs, or is the system doing what it said it was going to do, and then also monitoring student outcomes. Then we want to evaluate the impact of policies and programs. If we make changes, if we make innovations, are they working or are they not working? Again, people tend not to do this, which really limits the result of their efforts. And then for planning, for budgeting, again, for planning service delivery at the school and class level, as well as service delivery at the child level, especially when we're talking about inclusive education and we're talking about every child getting getting the supports they need. And then also awareness raising is another reason for data collection, right? To raise the issue in people's minds that this is important, that something needs to be done. And then a big issue that comes up over again is how do we identify children as having a disability within the EMIS questionnaire? We have some tried and tested ways for surveys, and we can talk about that if you want, the UNICEF Washington Group Child Functioning Module. But how do we do it in an EMIS questionnaire, which is different than a household survey? As we talked about in the webinar, there's some not good ways of doing it. Asking if a child has a disability, how many kids in your class have a disability is not a good way. Asking about a list of medical diagnoses is not a good way. When I showed the slide to Seguro, he said, well, wait, but there's times we really do need to have a medical diagnosis. And that's true. for certain programs, the eligibility, especially for social protection programs, the eligibility for certain programs hinges on having a medical diagnosis, which can either trigger a functional assessment or not. But that medical diagnosis is a gateway in order to getting into those programs. But within an EMIS or a household survey, trying to identify kids with disabilities in the school or out of school and how the school system is serving or not serving them, it is not a good way. But we can talk about when it does. Medical diagnoses do have a value, just not for many of the purposes we want them for within an education system. And then receiving special services. Some countries report the number of kids with disabilities as the number of kids receiving special services, which again is not a. It's a good way of keeping track of how many kids you're serving, but it's not a good way of identifying the children who have difficulties in school. Because if you don't have services for certain kinds of difficulties, you're not going to have any kids, right? So we want to identify children's difficulties doing activities, not what the child has, but what the child has difficulty doing, right? We're trying to think about how we can build a school system that meets every kid's needs. If we don't know what the child has difficulty doing, we don't know what the child's needs are. Two kids with the same diagnosis might have very different needs. And then it's up to the education system to provide that environment to be able to support all children. That's what we mean by inclusion. And when we're talking about data on the environment, we're talking about physical accessibility, informational accessibility, materials, the training of the teachers, pre and in service, and support specialists. And as we mentioned in the webinar, how we collect that data and what we collect can be very country specific because whereas children are the same everywhere, the environments are not the same everywhere. And so sometimes we have to adjust, but how we ask them, whether we do it through an EMIS, to what extent we want to do it through audits or inspectorates. Okay, so just to give you an idea of where the group is at, we asked you to describe your system, and we have more responses than countries. So there's going to be, this isn't very scientific, but it gives you an idea of where people are at right now. You're about split between paper and electronic, and there's different issues when you're collecting data through paper censuses and electronic systems. So there's multiple responses from countries. There's only 8 countries, and we have 11. So where most people have it at the beginning or the middle of the year, only 2 responses said you collected data in an EMIS more than once a year in order to track the children over the course of the year. So we're getting EMIS is giving us a snapshot most of the time. And the teachers are the ones providing the information, which is great. We can talk about teachers versus administrators. And then 5 actually had data at the student level, which is actually really high. Most EMISs I've been involved with, not in high-income countries, but in low and middle-income countries, don't track data at the student level, which is great because it's really what you need in order to be able to provide inclusive education. We have almost all of you do collect disability status in some kind of way. Again, this is very high. About half of you collect information on facilities and materials. I did a review of 40 EMISs a few years ago, and only 2 or 3 of the 40 collected information on facilities and materials. So the fact that half of you are either means you're a really good group or things have gotten a lot better. Teacher training is about half and half. And most of you actually produce reports from your EMIS, which is also not universal. People collect data and not do anything. So that's kind of where we're at. And Suguru is going to now present shortly on more about uses of data, and then we can get into a discussion.
Okay, so then I will be talking about data collection and utilization. Okay, so what kind of data? Data is quite a vague concept, and so I want to give you kind of the main source of data that you would like to consider when you think of analyzing, planning, and evaluating and monitoring inclusive education. The first set data is survey, which includes census and household survey data. And then the normally National Statistics Offices lead the process. Administrative data, which includes EMIS, but also other administrative data such as health. And it's a great source of information in terms of the various head counts and information, and including teacher number of children with disability in school. And the line ministries collect these data. And the third type of data is what I call policy, finance, and system data. It's quite vague, but on top of survey and administrative data, you need to have information. Data means information. So you need to collect policy, okay, starting with constitutions, the laws and policies, regulations, guidelines, and so on. That is the policy data. And you don't want to just collect education data. You want to know what's happening, how the Ministry of Health defines disability, how Ministry of Labor is defining disability, what kind of programs they're providing in order to support children or people with disability. And also finance is part of the policy finance system data. Then qualitative data. And qualitative data tend to be very important in order to unpack the reasons or the mechanisms among different factors, how different factors affect the education decisions. And for this type of data, normally Minister of Education or the many scholars collect, and which informs the program design and strategic decisions. So I'm talking about mainly 4 data. There are other data, but let me just summarize that there are 4 kinds of data that you want to consider. All right, survey data. So they are quite important in order for us to understand the big picture. How many people with disability, children with disability exist, and where they are located, what is their household income levels, what about gender, are they attending school? So we can calculate a lot of indicators at national and the lower administrative levels. And we know the distribution. Are they concentrating in the city areas or the rural areas? Are there any specific age groups which suffer from a certain type of disability and so on? So it's not just national figures, but also distribution that we can learn. And that kind of information gives us the good understanding about equity. Okay, when we talk about inclusive education, it's not just about disability. Disability is important, but we want to consider other aspects of inclusiveness. And then that household data and census data gives you a very good understanding. And when it comes to the data collection related to children with disabilities, very often questionnaires are designed to ask questions to parents. So the data provider tend to be parents. The major limitation of such data is that they don't collect data every year. Census is held maybe like once in 5 to 10 years because it's so expensive. And household surveys like 3 to 5 years, unless the certain types of disability module is institutionalized. The government to implement household surveys almost every year, but it doesn't mean they collect data on disability every year. Right? So the data collection period can be very wide. Right, and then these data, it's very important for us to understand the situation. So it's good data source for situation analysis for inclusive education sector monitoring and planning. Right, so let me just give you list of resources, data through these 2 the approaches, census and household data. So a lot of modules has been developed by the Washington Group on Disability Statistics, which includes short set of questions, which measures 6 domains of disability and mainly targeted adult population. Then there are 2 child functioning modules, one for very small children, 2 to 4. And another is for bigger children, 5 to 17, and they are covering similar domains, but the domains don't match exactly. So 8 domains for small children and big children for 11 domains in terms of UNICEF reporting system. And then there is a foundational learning module to assess learning outcome at the grade 2-3 levels. So this kind of household module can be used to assess children's learning outcome. Then the Washington Group and UNICEF is trying to develop inclusive education module, which assess attitude, beliefs, and also the enabling environment of schools, and using household surveys. So these are the resources available for all the countries to use. Now, the administrative data, this is a great tool for understanding big picture again, but the great part of it is that the data collection is annually at least. So you have a routine system to collect data. So improving MS to collect IE education is so important because it gives you the data every year. And then you have the full set. It's not sample, right? So you have the information from all the schools of your country. So this is a great system. And if we have to invest in data, this is a place we should. And the question might be around like how we collect data, like how we identify children with disabilities or children who have the difficulties in doing certain types of activities. That is I think, open question. And the instrument can be MS and also the school health program and so on. And data collection is at least annually. And the limitation is that it doesn't cover out of school population. If you are in a country where vast majority of children are in school, that's okay. But if you're in a country, you're from a country where there are a lot of out-of-school children still exist, then this might miss out the information about children with disabilities. Okay. And policy finance system data. This is the data for like designing, reforming, and improving what we do. The system, how we improve system, we have to collect this kind of data. Okay, policy data. As Jim mentioned, we tend to have constitutions which talks about rights for children or people with disabilities, but that kind of vision have to be translated into lower level of the administrative system. So education law, policy, the ministerial decree, decree, and guidelines have to be developed. Okay, we have to identify policy gap and we have to fill that. And the data, but then again, the data have to be collected not from just Ministry of Education, but from other ministries, because what we want to do is that we want to provide all sorts of services, okay, seamless services between Ministry of Education, Health, Protection, so that people with disability can realize their rights to so many things. Right, and the policy for improving quality, which is related to service delivery a lot, as teacher training policy, curriculum, teacher management, and so on. This kind of information is, of course, important. And the finance. Okay, we want to develop a system for children with disability. So like estimating the unit cost, again, it's not easy because we do not want to have specialized program for children with disability, but estimating a certain cost and find a way to finance it is very important. Qualitative data, we want to know why. Okay, the surveys and censuses may tell you X% of children are not attending primary school, but surveys very often don't tell you why these children are not attending school. It is very difficult. It is sensitive. And just sending questionnaires or just sending strangers, interviewers are strangers, okay? So the parents don't disclose the true reasons. So for that reason, qualitative interview is very important, okay? So we can address different kind of why questions, why children not attending, why children dropped out, and which will inform how we design our programs, how we should improve our system, what kind of new approach is needed, and so on. Okay. So data source for qualitative study is going to be various because you want to know the information from different stakeholders in the system, starting with the children, parents, district education officers, ministry, senior officials, or maybe community leaders or religious leaders. As Mark showed, a lot of countries have very good, much better education laws in terms of inclusive education, a lot of policies there, but we also know that policies are not functioning. So you want to identify policy gaps. Why policy exists but not working? So then there got to be reasons why certain factors are not, stakeholders are not doing their job, or there are some factors prevent people who want to deliver education to children with disability not to do the job that they are supposed to do. Okay. The limitation of such data is that the generalization. So because you're talking to a group of people, so generalizing the result is a problem. But as long as you link the quantitative survey result and qualitative survey result, you have a very good basis to make the make the findings. as a driving force to push national discussion for inclusive education. And Dan started with the presentation by stating we have to know the purpose. And I just want to give you one idea of how different data are related to the processes of the education sector planning and monitoring. Okay, so survey data is very useful for sector analysis, situation analysis, to understand what is the current situation, and also useful for the monitoring and the evaluation if your policies are working very well or not. Admin data, same. It's a very important source for situation analysis to know where we are and to understand what we have been doing makes sense or not. Policy finance system data, very important for us to strategize, coming up with the different policy options, and also think of the cost implications. Qualitative data is important for us to, again, prioritization and to design, to come up with an effective program design to provide the education to children with disability. Okay, with that, I will finish my presentation. Thank you.
I think I'm doing this, aren't I?
Yes, you are.
Yes, I am. Okay. Do we have any questions or comments or suggestions or feedback on data? So one here, one over there. Yeah.
All right, let's start over here with Mr. Mele.
Okay.
Thank you very much. Even in the morning session, I have heard a lot of experience about data collection, but I have a little bit worry in my mind regarding data collection, but let me raise some questions. In order to conduct data collection in any country, it requires data collectors who are trained well. And the other one is it requires also budget. So particularly in Africa and other low-income countries, it may be very difficult. And the other one is in the context of Africa, it requires also political goodwill. So how this situation will be well addressed, in order to conduct a true data collection process. Thank you.
Shall we collect a few first?
Yeah. So second.
Thank you so much for your very comprehensive presentation. Just Daniel, you share the very valuable presentation during the online and the today also, and you highlighted the new dimension for the inclusive education, especially for the children with disability. Just no labeling, who is and what kind of disability no matter, and what kind of service we have to provide. That is the functional limitation, and we are following Washington Group questionnaire also. But at the same time, I'm very pleased to this one, and at the same time, I'm worried also. How can we justice your opinion? Because in many today also in many planning, we need data, everywhere data. And at the same time, how many children are there with disability and the type of disability. And we usually ask how many students you have with disability, this kind of things, and we are making them practice. And this is the departure from labeling to support to need of the children, and how we can go ahead regarding this issue. And I think it should be an agenda to discuss here. Thank you.
Should we go to Sai next?
Good afternoon, everybody. I'm Sai Väyrynen from the Embassy of Finland in Ethiopia. Yeah. I'm representing here, I think, the development partners. And development partners are obsessed with data and the accuracy of data. And this is a big discussion we have in Ethiopia. So I think it's data merits serious discussions. Just two issues that didn't come out in the presentation. First of all, I'm very pleased that you also talked about the qualitative data. That's an aspect which is missing very often. But what I have realized is that very often qualitative data analysis is very weak. It's more at the description of what is there and what I see, rather than in-depth analysis. So the question is that how can we strengthen this? The second question is related to EMIS data, and I think we will discuss that later on. It seems that in many contexts, EMIS data is collected, for example, once a year. And once a year, the sheets, the papers, or the Excel sheets are sent to the schools, and then the principal is filling them out and sends them off, and then they are collected and analyzed. Next year, same thing happens, and it happens, and it happens, and every year they start from the scratch. And the question that, well, it's not really a question, but I really think that it's not really problem of the data collection, but it's the problem of lacking a kind of continuation of the data. It's not checked against the previous years and so on. So in many African countries I have experienced is that the data one year shows this and next year is something else, and there is no logic in that. So by default, all our analysis and also our decisions are based on kind of dubious data. Thank you.
Thank you very much. Again, the data issue is also quite a challenge sometimes. One of the things we have noted is that there is inclusivity in terms of the inclusive education, that in some areas we are finding some disabilities are getting a lot of attention, others are not. And therefore, you find now inclusivity within inclusivity again, so that you have to get more data where those areas that are not being given that attention. And that prioritization, sometimes we may be guided also. How do you also, what are the key areas of intervention in, what are the key disabilities, and what are the country-specific, sometimes even disabilities that are not seen elsewhere? And how do we handle now that difference? Then the second thing is that most of the countries are using the EMIS system to collect data. Currently, the way EMIS is structured and configured may not be so specific to the disability or to the inclusive education data, especially in that line of even identifying and knowing when do I call this a disability case. And therefore, we may need again to relook at EMIS as it is structured now, to also maybe have another tool that may collect now more specific data for the disability area. That's a proposal.
Just one quick thing. Can you say your name and where you're from as well? I should have said that at the beginning. Whenever you ask a question or do anything, can you say who you are, just so that we all get to know each other's names?
Okay. I'm Michael Kahiti from Kenya, Ministry of Education. Thank you.
Said it before, yes.
So I see we have two more questions. Do you all want to answer first?
And then you go back.
Yes.
Sure. It's hard.
About, yeah.
The first question about the difficulty in collecting data. You said there were three issues. You said training, budget, and political goodwill. First of all, sometimes the training isn't very much, okay? So when we talk about, for example, collecting data in surveys, survey modules, we have developed and tested these models in a lot of countries, and the training for when their modules were included in existing surveys, remember those people, those enumerators collecting the data are already trained to collect data. They don't need to know anything about disability. All they need to know how to do is actually answer the question as it's written on the page. And it doesn't take a lot of extra training for that. And we have examples of that. And right now the mix is going out into 70 countries using the child functioning model. It was tested in multiple countries, in low-income countries, and there really was not an issue with the training. In terms of the budget, again, it's a big budget for surveys if you're going to launch a national disability survey. But if you're going to include questions on disability in existing surveys, then there actually isn't very much extra budget, right? If a country was going to do a mix anyway, and now you're saying, okay, do the mix, but include the child functioning module. It doesn't require any more sample, doesn't require any more interviewers, it doesn't require any more printing, it doesn't require any more analysts. It just requires an additional, I forget, 10 minutes or I don't even know if it's that long, onto the survey. So the budget, again, is if it's being incorporated into the national statistical system, training and budget really aren't an issue. Political goodwill is a different story. You have to motivate. I'm a statistician, not a politician. So that part of it, I leave up to you. Other than to know that if you do collect data, that will help you develop the political will if you can demonstrate what's going on. For EMIS, it's a little different story. In terms of, but even there, they're already doing an EMIS, so to include information on disability is not going to be a major expense, right? The whole infrastructure for the EMIS already exists. We're talking about changing questions, modifying it. And with the EMIS, one of the good things is that if teachers are doing it every year, they become familiar with the form, and the training can last, and teachers can help each other out in terms of figuring the question. So I really don't think those are big impediments. I totally agree with what you were saying about the qualitative work. I actually think it's harder to collect the good data and build the capacity for the qualitative than the quantitative. Because the quantitative, we can design with a bunch of experts, we can test a bunch of places, we can develop some training materials, and there it goes. Qualitative, you need to be a highly skilled person to be able to know how to lead a focus group and get that information and then analyze it. So I think that's where sort of real capacity building is needed more. I also agree that when EMIS is once a year, especially if it's at the beginning of the year, it's going to be a whole lot less useful than the example you'll find this afternoon from Fiji, where they have a granular system that's collected and updated throughout the year, where they can track kids from year to year. And we want to move towards that kind of a system. And in that system in Fiji, they actually tested the teacher's classification of the disability status versus the parents' responses versus a clinical assessment. And they found that the three actually matched pretty well. So in that instance, in Fiji, we have actually empirical proof that asking teachers about children's having difficulties doing things actually seems to work well. And in a UNICEF pilot test in Tanzania, which wasn't done as rigorously as the work that was done in Fiji, we found the same thing. In terms about some disabilities getting a lot of attention, I think that's more of a problem when you talk about medical diagnoses. There's one country I'm not going to mention, where the wife of the head of government had a nephew who was autistic. So everybody wanted to be autistic because that's where all the resources went, right? So we want to get away. I think it's actually less of a problem if we start talking about the difficulties that kids do. Which ones are most important? It's a country context. There was a study done in Cambodia which showed in certain areas of Cambodia, the rates of hearing difficulties were really high among kids because they were bathing in water that gave them repeated ear infection. So in Cambodia, in rural areas in Cambodia, hearing difficulties was the priority, but that was data-based, right? In a different country, it might be different. In the study done in Bhutan, the highest rate was children with cognitive issues, and there was reasons for that. So the data, the evidence should drive where your priorities are. Oh, and then when does a kid have a disability? Like I said on the webinar, in the perfect world, we wouldn't have to even say a kid has a disability, right? But we're not going to be in the perfect world for a very long time. So there are reasons why we have to identify them. And there, I think, again, it should be identified based on sort of the level of difficulty the kid has doing activities. And the evidence we have is that teachers are able to do this, especially if it's not done the first 2 weeks of the year in a class of 80 kids. I mean, then they're only going to identify the most severely, your only hope is the most visibly severely disabled kids. We want to get all the kids with difficulties. We need to be able to improve the way we collect that data.
Let me add.
I'm going to just take some out of the Q&A since.
Yeah. Let me just make 2 points. One is that you don't need to implement household surveys. Okay, so we have modules. That's a small set of questions. And also you don't need to wait for mix, because mix is actually the multi-cluster indicator survey of UNICEF is the first household survey which adapted child functioning module. So it's not mix module, right? So it means that any house surveys can adapt the module, right? So, and then your countries has been implementing household surveys, so you need to work with Ministry of Data or the National Statistics Office to incorporate certain set of questions. And then these are planned already. So whatever the cost might be, marginal cost for additional 10 minutes of questions. So that will reduce your financial burden. And in terms of the data quality, I think the problems comes from the fact data is not used by the data provider. Those who are providing data to Ministry of Education is not using the data. That's why they don't care about the quality, right? So that process has to be addressed. So this is not just about inclusive education. This is the problem of the many MES and other systems. So we need to provide feedback mechanisms so that we collect data, but we provide data back to the provider so that they can make right decision at the school level. And also, it talks about accountability. The minister doesn't care about data. Like we collect the data on children with disability, and 1 year it was 1,000 children with disability in school. Another year it becomes 500, and the minister doesn't care because he's not accountable. He doesn't think it's important. So there's something wrong with the accountability mechanism. And again, this is not a particular issue for MES or inclusive education, but we need to address these fundamental problems through a sector approach somehow. So it's good to have inclusive education approach together with the education sector analysis so that you can address this kind of fundamental problems related to data utilization and accountability.
Yeah. And we have a Q&A session in a little bit, so I'll start with you and then for the Q&A just right after this. Okay. Now, okay.
I think I didn't turn on. It works.
Oh,
okay.
got it.
I didn't have it on. I will try to start as fast as I can, but we will be talking about assessment of system capacity. So if you're looking at the inclusive education conceptual framework, we have all these different blocks, as you know, and then the one-pagers. But then there are two things that don't fit in or not included. Number one is education sector analysis, and we've had a session on that. So you can have a system, but in order to make sure you have a system and you have everything that you should have in a system, in your system, you need to go and do the analysis, right? And then the next thing is we started talking about a lot of data collection. We collect data and then we start questioning why do we collect this data? And then we design programs or interventions that we think should address the problems that we think we have. in the system. But if we don't look back and assess the capacity of the system, it'll be very difficult to tell whether the system is working or not. So this is something that we started to touch up during the panel Q&A when Ghana was talking about education sector analysis. Well, how do you know whether things are working? So you can have a perfect, my clicker, okay, sorry. You can have a system that you put in place, right? But then you can do system analysis, but then you still need to assess the capacity of that system. So when we, trying to multitask here, you know, looking at my slides and, okay, so effective policy implementation. So you need to have knowledge and understanding of inclusive education. So we all know that. So that's the what is inclusive education, the principles and definitions, and then you also have to have adequate capacity to implement, right? So the adequate capacity is not just at the federal ministry level, but then who will actually be implementing the system? So you go down to the district level and then the school level and the community level. And so that's something that we found out in Ghana very quickly, that when we looked at policy analysis was very quick because everybody was aware of the policy at the federal level, but then you go down to the district level and you start having problems pretty much immediately. And those are the people who actually have to be implementing the policy. So you could be going through the motion and say have an inclusive teacher training module, and you have teachers going through the system and they're all getting their certificate, or they're getting through the module, they're getting their diploma, but they actually don't believe in inclusive education, right? So the key to understanding and analyzing implementation is assessment of system capacity to implement inclusive education.
From your slides.
I'll click for you because you changed that there.
It's okay now because I was, okay. So we've got our system. So I'm going to go back to my analogy of the cakes. Now, remember, so you have all different kinds of systems, right? And some look really good, right? But it doesn't mean it's actually a good system or it's a perfect system. So, or sometimes the cake doesn't actually look that great, but it actually will be a good cake. So the same thing with our conceptual framework. You can go and tick all the boxes and you can actually say that you have every single thing in your country, but you need to start looking at understanding the capacity of the system, which we found out in Ghana was actually not that simple. So I don't want to be speaking on behalf of the team, but I'll try to do the best I can. So I went to my good friend Wikipedia, and I tried to identify first capacity. I have 5 minutes left. Thank you. One thing that Jim likes to say a lot is that this whole institute is about building capacity. So when we talk about what does it mean, the term capacity, so when we talk about education, and educators typically use the term capacity in reference to the perceived abilities, skills, and expertise of school leaders, teachers, faculties, and staffs, most commonly when describing the capacity of an individual or school to execute or accomplish something specific, such as leading a school improvement effort or teaching more effectively. So I think that's really important. So if you just stick the word inclusive there, it becomes, you start breaking down what people need to be able to do, or the knowledge they must have in order to do their job effectively. So the term may also encompass the quality of adaptation, so the ability of a school or educator to grow, progress, or improve. And we know that in terms of inclusive education, these things are really important, because we are asking very often regular teachers who have not had training in inclusive education to go through the training and then to adapt, to improve, and to make changes to the ways they do things, or the ways they see the system, the ways they see a child, the way they see the curriculum. So the phrase building capacity refers to any effort being made to improve the abilities, skills, and expertise of educators. And if the purpose is to reduce schools' reliance on outside contractors or services, for example, educators may say they want to build internal capacity. So we started realizing that in order to implement or successfully implement a policy, you have to make sure that internal capacity is built not only at the federal or main ministry level, but you go down to all the different levels. So the way we see assessment of system capacity is just like slicing a cake. You have to look at all the different technical capacities and core issues like institutional arrangements, leadership, knowledge, and accountability. And then you have to engage the stakeholders, assess the situation, and create a vision and a mandate. Then you have to formulate policies and strategies, budget and mandate, and implement, evaluate. But the most important part here is that you have only certain points of entry. So you have to identify those points of entry, and that's where you'll be slicing your cake. So in Ghana, so mobilize and design, I know I don't have much time, conduct capacity assessment, and then you have to summarize and interpret results. So in Ghana, we've actually, with very little time that we had, we tried to design the entry point, the capacity assessment mechanism. I'm going to skip through this slide.
You have 3 more minutes.
Okay. So we've tried to, the what and the why, we know why we're doing it, and there are a lot of things that are being done in the system. So that's the how to implement inclusive education. And different district offices have their programs and they're going about doing it. But the entry points, here, we started from the very bottom. So we needed to understand, is the system working from the point of view of a child? And not just any child, but a child without disability and a child with a disability. So earlier there was a question about attitudes. Well, you need to make sure that your attitudes are all aligned, not just attitudes of children with disabilities that they're ready to go to regular schools, but you have to have also attitudes of children without disabilities and community members. So then we found out that children without disabilities, we can go to regular schools and find them, but then children with disabilities in Ghana, they're in special schools and inclusive schools. So we needed to find out, how do they get on with their program, curriculum, their life? And then teachers. So we also broke down the teachers into 4 different categories. You have some teachers in special schools, and those are teachers who have had training in special needs education. Then you have regular teachers who may not have had any training in inclusive education. Then you have resource teachers who have been specifically trained in inclusive education. And then you have head teachers who may or may not be trained. And then the teachers, again, you have some teachers in special schools, regular schools, and head teachers. And then you go down to the parents. So you have parents of children with disabilities and parents of children without disabilities. So of course, a child is 5, 6 years old, is not going to always find the service or availability of the service or get the screening or assistive device. It's the parents. So it's the knowledge that the parents have, the attitude towards inclusive education, towards education in general. So we wanted to make sure that we interviewed parents, not just of children with disabilities, but parents who have children who don't go to school, parents who have children in regular schools, and then both inclusive and non-inclusive classes. And then we have parents of children in special schools. And then when I showed the slicing of the cake, we have focus groups. Focus groups are very important. So in addition to talking to government staff and making sure that their understanding of the policy and their capacities are built, we want to make sure that community members are involved and they understand that there is an inclusive education policy in Ghana, and this is what's available, and that's where the child should go, and these are the services that they have to offer. So that was the questionnaire that was distributed to them. And then I know that the DPO was very much involved in assisting in assessing that part of the capacity. So this is, in a nutshell, what happened and what we did in Ghana. And all the questions or questionnaires that we designed as part of the assessment of system capacity, and also the design of the capacity assessment, will go in the methodological guidelines, and the explanation on how to use all the questionnaires and how to set up a system to assess your system capacity will go in the operational manual. Thank you.
That one seems to be working well.
Okay. Can I? Is it? No. Okay. Okay. Thank you. Okay. The objective of this presentation is to share with you some thoughts on costing and financing inclusive education issues. Here, the presentation will be organized around 3 points. Inclusive education. Why is it important to cover this topic when we talk about inclusive education? How to cost inclusive education and how to finance inclusive education. You all maybe know covering financing issue when we talk about inclusive education is very important. First of all, because of implementation purpose. We all know that money is very important. If we don't have money, we cannot do many things. So it is difficult to promote the implementation of inclusive education if we don't know how much it costs. We need to know that first, and then how it's funded. It's very important to have these two elements. The second reason is that most of the time we have some budget constraints. In most of countries, education budgets are often limited, such as in Africa countries, and then priorities may be elsewhere than in education sector. Even if we have something for education sector, we know that children with disabilities appear to be often in the last of the line. So it is important to be interested to financing issue when covering inclusive education. We know also that most of the education budget in many countries are not sensitive to inclusive education. This review from Development Finance International in 2016 show, for example, that more than half of low-income countries do not have a specific budget allocation for children with disabilities or for special school. Fourth reason, it is about sustainability concerns. While providing inclusive education is the responsibility of the state, most of the time, what we note is in a greater number of developing countries, NGOs or project funded are the major funder of inclusive education. It's like government are not paying sufficient attention on inclusive education issues. I don't want to be exhaustive because we can have many reasons, but because of the time, let's move ahead. So, advocating for a better financing of inclusive education requires first to know how much it costs. That is the first point. If you want to go and to discuss about money, the question we will ask you is, how much is it? And if you cannot answer this, we cannot give you money. So it's very important to know that. The question is now how to cost inclusive education. Most of the time, I cannot give more detail here, but I think that there is two key elements to consider. The first element is about the requirements for inclusive education. In each country, according, for example, to inclusive education policy, requirements can be organized around various headings like early assessment, assistive devices, teaching and learning material, teaching, and so on. So if we know we have all these requirements for inclusive education, the second aspect will be to identify the unit cost attached to each item. Because yes, it's important to know the requirement, but it's also important to know what is the cost attached to each requirement. And then putting these two together, it will allow for assessment of the total cost of inclusive education, having in mind the perspective to split it between recurrent cost and the capital cost. Because if we are working with capital cost, we need to use the lifespan. For example, the building will take maybe 20 years, but the recurrent costs are the frequent one, and then it's important to have it in mind. What is important when doing this is this kind of exercise is to have a comprehensive picture of all the requirements. If we don't have a comprehensive picture of all the requirements for inclusive education, we will underestimate the cost. The costing is very important. The second aspect is to ensure that the unit cost reflect reality and take into account context specificities. It's very important so as to make the costing reliable. So it may be useful to cross many kind of cost, because if you went to the countries, sometimes you can have some standardized unit cost. They will tell you that, okay, for the building is 20 million. That is the standardized cost. But 20 million is not the same cost if you are in the rural area and in the urban area. So it's very important. It's very important to pay attention on the market prices. So some item maybe not have, for example, standardized or official unit cost. And then we know that from pilot experiences, also we can have some unit cost. So crossing all this kind of cost may be useful to identify the more reliable unit cost for inclusive education. Here is an example of the requirement for inclusive education based on Ghana experience. I have my colleague from Ghana. They may explain if needed. So we have early assessment into basic screening, and from those who are identified with some impairment, for example, we have a further diagnostic to identify the severity of the disability. And then we have the assistive devices that will be identified by type of disability. And then we have accessibility of infrastructures. We have two cases. For the existing building, for example, it may be interesting just to upgrade. But for the new building, maybe it will need to have the total cost, including all the facilities, to take into account inclusive issues. We have also sensitization with children with disabilities and children with disabilities, even if it's not appeared there. And then with communities. And then we have the capacity building of teachers. I mean training of teachers. Okay, so it's very important. We have the teaching and learning materials that will be identified by type of disabilities, and then the curriculum and assessment. And then some countries maybe add also the social intervention. So having all these, having all these can be useful, but it's not sufficient. It's not sufficient because one of the most important aspects is to question also the sustainability of the cost toward a financial simulation model. I don't know how many of you have already had opportunity to see what is a financial simulation model, but let us go. How it's work. We have school age population. And then from the school age population, we know who are the children with disabilities and who are not children with disabilities, basing, for example, on the prevalence rate and on the type of disability, we can have some estimation. Basing on the enrollment objective, okay, intake rate, flow rate, promotion, repetition, and so on, this will help us to identify the enrollment expected each year, both for children with disabilities and for children without disabilities. And then with the learning and teaching organization or objective, we are going to group them into classes, how will be the time load for teaching regarding with respect to curriculum and so on. We will be identifying the physical needs. The physical needs in terms of assistive devices. We know how many children with disabilities we do have in the system with the type of disabilities and so on. So we can know what kind of disabilities and how many assistive disability we need. Teachers, how many teachers we need for the whole system. Learning materials, teaching materials, infrastructure, and so on. And then this, with the unit cost attached to each item, we can finally identify the total cost expected each year, recurrent one, and then capital one. And this is very useful to question the financial sustainability. At the end, is it affordable? Even if it is affordable, is it feasible? I have experience on that in Congo. We have done this kind of work. Money was not the problem, but the problem is, are we able to do it? We need to recruit, let's say, around 4,000 teachers every year. But if we took the capacity of all the training teachers in the country level, we cannot provide that. So the physical sustainability is very important. So now that we know the cost, it is important to be interested to how it can be funded. And then we have to rely on the main sources of financing or funding. National education accounts appear as a comprehensive framework to understand who are the main funders of education and of inclusive education, how much is spent, where do the funds go, on what the funds have been spent, who benefit from the fund. But most of the time, the problem is this kind of framework is not often available. We have just in Africa, for example, 3 or 4 countries that have done this national education account. So it's difficult. But the main source of financing the total resource of education came most of the time from 3 sources. We have government budget, we have external funding, and then we have the private one, including household, communities, private company, and so on. What is the situation? Regarding the government budget, it is recommended that to government to spend 4 to 6% of GDP to education. But the situation is many sub-Saharan Africa countries are still far from this target. So we have a problem there. Let us take now external funding. Okay, here the target is to spend 0.7% of GDP for official development assistance. But if we look at the trend, we will see that international aid to education is also declining. It's not me, it is Global Monitoring Report 2016. So if you have question about it, my colleague is here So we have private funding. Regarding private funding, we know that households are contributing significantly to education financing. We don't know much more about private company funding. Maybe this is a way to explore. But if I focus on household, expanding their contribution can affect negatively inclusive education. Why? Because most of the time, children with disabilities come from the poorest household, those who are not in school. Children with disabilities that are not in school are coming from poor household surveys. So this is not a best way to deal the issue. So regarding all this situation, there is a need to find a sustainable and innovative financing for education that will be reaching all children and leaving no one behind. So how to do that? Let me tell you that there is no magic solution. I don't have the solution. I cannot tell you how to do that. But there are some various country experience from which lesson can be learned. I think that we are here, we will be interested to hear about your experiences from your countries. Maybe I think that one of the purpose of this technical roundtable also is to exchange our experience and to see how we can learn from each other. So it's very important. But there is a common agreement that it is not possible to ensure sustainable financing of inclusive education without increasing domestic funding. Why? Sustainable financing of inclusive education, if you want that to be sustainable, it should come first from the countries, not from the international donors. It's very important if we want that this be sustainable. How can we do that? There is some ways to do that. We know that we can widen the tax basis, for example, in most of African countries where my experience comes from, there is some possibilities there. We can prevent tax evasion. I know that there is some possibilities also there, and then we can improve also the share of budget allocated to education to reach the 6%, the 6% of GDP. But it's not only this. We need to evolve also toward inclusive, responsive budgeting. Education budget should be aiming to improve and maintain the whole system with inclusive lens. It's very important. We say that the government commit that no one behind. We don't need to leave no one behind. So it's very important that is done on inclusive lens. We have to ensure efficient use of existing resources. A greater financing of inclusive education is not only the result of increasing resources. Sometimes it's also a strategic use of the existing resources. In some countries, for example, I'm sorry for the time. In some countries, for example, the problem is how the money are used is not efficient. They are wasting money with no result. So it's very important to pay attention on the strategic use of the existing resources. That is very important. And then I think that one of aspects is to ensure also budget transparency and accountability mechanism. A better accountability will provide credibility for other stakeholders, such as private sector, donors, on where and how to fill the financing gaps for inclusive education. So I would like to invite you all to unite for inclusive education, and that is it. Thank you.
I just wanted to say one thing. A year ago, we didn't know much about financing of inclusive education, but we always talked about looking at education finance through an inclusive lens. We got an education economist, a finance specialist, Biffett, who came to Ghana, and he became an inclusive education expert, finance expert. He's now been speaking on some meetings we had with the World Bank. He now has so much information, and I'm hoping that Paul Delacare will be able to contribute to the methodological guidelines, because the finance section was the least developed because we couldn't find any information. So thank you.
You've got this.
Sorry?
Okay, go ahead.
We've already got
Yes.
2 urgent questions. We start here first? Okay, and then the 2 of you.
Hello, I'm Subeksha from Nepal. So I just want to highlight the one fact that in EMIS, we collect the data which are more visible, which is easy to identify, like physical impairment, hearing impairment, visual impairment, and all those things. And then in terms of humanity and inclusion, we have just conducted one study using these functioning group of child functioning model. So when we did the survey, we came to know that around 26% of children have some kind of functional limitation. So there is a huge gap between 26% children have some kind of functional limitations in 40 schools that we conducted the research. So there is a huge gap between the census data, which is just 2%, around 1.96%, and then the data that we collected through this child functioning model. And then among those 26% also, there are 50% children, they have the learning disabilities or hidden disability. So I just wanted to highlight the fact that how can we integrate those learning difficulties children into the EMIS? Because of the learning difficulties, they are not able to achieve the learning outcome, which is one of the factor for dropping out or repetitions of grades. So in EMIS, this type of data are not integrated or are not addressed. So I just wanted to highlight how can we ensure that children with learning difficulties or hidden difficulties data are integrated into the system. Thank you.
And then one other from the.
Oh, okay.
Thank you for giving me a chance to ask the questions. My question is relating to the data collection in the past. So we have discussed quite a lot about what and why we need data collection. That's quite clear. And my question is relating to how we collect the data. For example, when we can talk about the approach of data collection, now we do the survey, as you all agree that it's quite expensive, and consensus is also quite expensive. Should we change the approach of collecting the data from like we do the survey, we have the data collector to go to every village or school to collect the data. That is, and the information from the student or children with disability is always changing. So just like we shoot into the moving target, it is quite difficult and costly. So can we turn it around from the children with disability, give us the information? So that is one way. How do you comment about that? And my second question is about how to apply the information technology for data collection. Because as you know that now we can access to the internet, iPhone, iPad. So can we apply ICT for data collection in the future? Because as in Vietnam case, now we are trying to set the system for social protection database. We use information technology for that. Can you give us the advice? And my third question relating to the financing education. I'm very impressed by the simulation of the financing. That's very good. But in the slide, you just mentioned the children that are already at the school. So the teacher can collect the information with children with disability and without disability. How about the children that are not in the school? For those who really need to be included in the school? Thank you.
Go to Rolando first, because I think he can answer one of your first question. Or start.
Hello, my name is Rolando. I'm from UNICEF Kenya. While I was listening to Daniel's presentation, there seems to be the need to focus on measuring disability based on levels of functioning instead of focusing on Down syndrome, autism. How do we then align that perspective to what Bifith mentioned when he talked about costing per type of disability? So when you put costs on autism, put costs on deaf blindness, how do we align that perspective from Daniel's perspective on level of functioning, and then bring it to the costing which focus more on autism, Down syndrome, and these very specific types of disability? Thank you.
Sorry, I'll try to keep it short. I was just wondering, picking up on Basif's presentation, that when he was raising the question of affordability, that quite often we are coming in, I'm saying we as development partners, coming in to convince the Ministry of Education that, for example, we need to increase domestic financing, whereas we find that our colleagues largely agree, and it's the Ministry of Finance that we need to also convince in this. And so I think in that it's seeing the cost of all of this is not just seeing the cost of inclusive education, but also taking into account the cost of inaction and the cost of loss of opportunity, and translating that into, say, cost benefit, taking a larger view on that helps the Ministry of Education colleagues as well, taking that to finance, because I think that's an important point, so that they also are provided with tools to convince finance in increasing domestic financing for this.
First, let me talk about the financing, because it's which I thought was a great presentation on the financing. There's only one thing I would add to it, and that is the difference between transition costs and and you talked about capital and recurrent, which is really important, but there's also transition costs. So to retrofit a school to make it accessible, to build an accessible school costs 1% more, right? So if all schools built from now into the future were made accessible, 1% extra to the budget. But in the transition, if you wanted to retrofit the schools, that's expensive, but that's a transitionary thing. That could be something that's good for donor budgeting, right? It's something budgeting that's non-sustainable. So that's just one little tweak I wanted to add, which I thought was a great presentation. In terms of costing per type, yeah, I think if we cost by diagnosis, it's not going to work, right? Like I said in the webinar, I can have 2 people with cerebral palsy have extremely different needs for assisted devices, which is why we want to identify the types of difficulties they have. Now, vision is an easier one. People can't see. I mean, it doesn't matter what as far as the school is concerned, it doesn't matter that much what the reason is why they can't see, but walking and communicating and things like that are a little different. So there's actually something called an ecological evaluation, where you go through and you look and you look at the kids' needs and the difficulties the kids have. You look at the aspects to the environment, and then you figure out what it needs to. I can share that with you, the work that this guy has done, Brent Elder, and that would be a way of costing it from the bottom up. From the top down would be. I don't want to take up everybody's time. The surveys, I don't think they are expensive if you're already collecting an EMIS. To make it inclusive, it does not require a lot of cost. It's just some transitionary costs. If you're already collecting household data, to add the washing, it doesn't add a lot of cost. And you're very lucky in Vietnam because you just finished a national disability survey of 35,000 households in Vietnam, so over 100,000 people, including the child functioning module. So in October, when your report is released, you will actually have detailed information of all the children out of school with disabilities and without. So you're in a good situation. That's a lot of money. You only have to do that once every 10 years, so you're okay. Including ICT, I think it's the same thing. However, the government is collecting data, we just adapt it so that we just include the question. So can disability data collected through ICT? Sure. And then the 26%, I'd like to know what the cutoff was. Was that with kids with any difficulty or kids with a lot of difficulty? Okay. So it's 9% would have a disability according to like the SDG disaggregation, and another 17% have some who might need things in school. But yeah, I mean, I think it just requires getting a good questions on the MS and the teachers trained to answer those questions. I'm going to shut up.
Maybe just add, I think the domains covered by surveys and the data collection you use are different. So of course, the more domains you have, the prevalence rate gets higher. So like you might want to pay attention what kind of domains are assessed in different kind of data collection mechanisms.
Is it possible to show the presentation? Okay, so let me go with the question about the simulation model. I think that it is important to have in mind that this work need to be doing in a mainstreaming way. We are not just talking about the simulation model for children with disabilities, but it is a simulation model for the whole system, taking into account children with disabilities. Let me explain. I don't know if we can show it, but you will see that the main driver of the model, it is the whole population, the whole school age population, including both those who are disabilities and those who are without disabilities. And then we are beginning with the school age population, whether they are in school or they are not in school. So it means that the model is taking into account all them. And then the critical point will be what is the objective of the system, what is the main parameter that the system is using. Yes, regarding the simulation model. Let me go there. No, yes, this one. Yeah, on this one. Yeah, you will see that it's okay. You will see that here we are talking about the whole school age population, regardless whether they are in school or they are not in school. So it means that if we have this as an entry point, we are taking into account also those who are not in school. But the main critical point will be here. What will be the enrollment objective that the policymakers are putting on the table? If they say that our enrollment objective is in line with SDG 4 to ensure that all the children, no one is left behind, it means that we will have 100% here. If we have 100% here, it means that we cover both those who are in school, those who are in school, and those who are not in school. So it's very important to have that in mind. I agree with the observation also that yes, sometimes, not sometimes, it's very important to have also for advocacy the cost of inaction. Sometimes it's better to show these kind of figures than showing this one. When the policy makers or the deciders can have a picture of what it is cost, what is the cost of inaction, you don't need to speak long time. You will put the money on the table. So it's very important. I fully agree that in this perspective, sometimes it will be very interesting also to have a kind of cost-benefit analysis, because this will also be important for advocacy. So if we, the main objective sometimes for the policy is to have what we call the value for money. If I put the money, on the table, what will be the result? So having this kind of analysis also can be useful for advocacy. And then I fully agree with the idea of the transitional cost. Most of the time, the beginning will be very costly. And that is where you can request the support of international partners if the national budget cannot cover that. But I fully believe that money is not the problem. Money should not be a problem. Money is the solution. So how to convince and to have money, that is the problem. Basing on my experience, the problem is sometimes we don't have the same dialogue between the sectorial ministries in line with the finance ministry. So it's important, a work needs to be done on the policy dialogue perspective, and this is not often done. So when they send them in the Ministry of Finance for the financial trade-off, they don't have argument. They don't know how to convince about the importance of having this or this. So I think that this is also a very important aspect on which we need to invest. Thank you.
Two quick things. One is, according to the International Labor Organization, the cost of disability is between 2 to 7, the cost of exclusion is 2 to 7% of GDP. Okay, so you actually can point to evidence that there are significant costs. That being said, I get a little nervous with cost-benefit analysis with education because, you know, some of those benefits occur way in the future. When you're estimating those benefits using data, one of the benefits is the kids with education will get work, right? But if you look right now, because of barriers in the employment market, if I use survey data to see how many of these kids with disabilities who are getting educated now are going to be able to work 10 years from now, I'm going to be underestimating the benefits if the country is also trying to make the transportation system and the labor market more accessible. So I think things are stacked to underestimate. The typical cost-benefit analysis is going to, in my opinion, underestimate the benefits. So I like to think of it more as cost-effectiveness analysis, saying we've made this commitment. All children should have an education. It's in the CRPD. It's in their national laws and policies. Now the question is, what is the most cost-effective way of achieving that? Okay, what policies will give us the biggest return for our money in getting as many kids into a quality education as possible? And we can talk about that. I think we can talk about this for an hour. But I think the cost-benefit, cost-effectiveness is something that we need to think about.
Okay, and yes, we're going to think about the. So Jim wants to have one word.
Okay. No, I was wondering in terms of the analysis, one thing you hear a lot about these days is political economy analysis and so on. We were talking a lot about in terms of capacity, and often that's the way donors talk about systems. You address the capacity through training, and then everything is fine. But one of the problems, I think, in many countries is that teachers are not really incentivized to address some of these issues. They're already often absent from school and so on. And having been a teacher myself as well, I realize that teaching an inclusive class is actually very demanding. So I think in terms of the analysis, we need to kind of build that in a little bit. And also maybe in terms of the costing. Now, if you give a teacher an incentive, let's say, if you're going to do inclusive teaching, but as a consequence of that, you're going to get support in the classroom from other people, then you might incentivize it. But if you neglect those areas, at the end of the day, it probably won't work. That will be a big issue.
Okay. First thing is, I think we all agree with Bifid that money is the solution to all problems. Second thing, the second solution is coffee, which is now available downstairs. But before you leave, right, when you come back, we're going to have a panel with Vietnam and Fiji, right? So we would like Vietnam and Fiji to stay in this room, Yeah. And we would like Ethiopia and Ghana to go next door, right? The other people, the other 4 countries, the African countries stay here for the first 40 minutes, and the Asian Pacific countries go there for the first 40 minutes, and then the other countries switch. Oh no, sorry, the panels switch. The panelists will switch. So Vietnam and Fiji come here, right, and sit at the front, and Ethiopia and Ghana go next door and sit at the front after coffee. Coffee's available downstairs. Is that clear? And we'll be around to explain this complicated system when you come back.